patient from one hospital to another doctor has been suggested bone marrow transplant. Patient cannot afford it. Splenectomy is advised. Patient does not wants to go through it. Is not ready. So the child is in too much pain. So I asked him, why are you carrying him? He said, he cannot stand. He has too much pain in his feet. Child is not able to stand. All his joints are painful. And whenever the fever rises, the child becomes cranky, wants to be left alone. Fever is not showing in the thermometer, but child is hot all the time. Child is hot all the time. Fever not showing up in thermometer. He wants fan and the maximum speed in fever also. Keeps feeling hot. But father is saying, Doctor, ਇਹ ਤਾਂ ਠੰਡਾ ਪਿਆ ਹੈ ਇਹਨੂੰ ਹੱਥ ਲਾਓ ਇਹਦਾ ਵੀ ਬੁਖਾਰ ਆਉਂਦਾ ਨਹੀਂ ਥਰਮਾਮੀਟਰ ਚ ਇਹਨੂੰ ਹੱਥ ਲਾਓ ਇਹ ਠੰਡਾ ਪਿਆ ਹੈ he is cold to touch and he asked for fan ਚਾਦਰ ਨਹੀਂ ਲੈਂਦਾ he does not covers he removes covers I tried to touch and examine him and his feet were icy cold feet. So I felt I have touched ice. And in clinic also he is saying, Papa, pakha tej kara do. He has lost 7 kgs in about last 3 months. He looks very weak and emaciated. He wants to bathe in cold water. That's one single thing that gives him relief. But parents are worried. They tell him, don't to bathe in cold water, otherwise fever will rise, problem will become more. Okay, this is the case. No mental symptom, nothing. The child is not feeling anything mentally. And Dr. Sonali has come up with carbo-veg. We need to save this child. Just see this report. Oh my God, what has happened? Yeah. Come on, everybody. Why are you silent? Let us do this. Rather than remedies, let us collect the data. What do we need? Fever is without temperature. Okay, that's very important. Fever without temperature. That summarizes the patient actually. Yeah, we need hemorrhagic tendency. Okay, what else? Hemorrhagic. Hemorrhage from almost everywhere. Fanning desire, yeah. Right. Maybe fanning desire with other kind of presentation. Dr. Eli is saying, I see cold extremities. Very important. देखो अपन को देखना क्या है? What strikes you? What's out of the way? Something you react to. अरे ऐसा ये कहाँ से आया? Yes, the patient is hot. In this also, he wants cold bath. Hot patient. Why, Dr. Chandane, why a patient does not want to be laid down? Because there is pain in feet. I gave you the reason already. Yes. Yeah, joint pain ameliorated by cold baths. Dr. Ella, nice. Important. Now put this in repertory, na. Look, don't use your brain to think about the remedy. Use repertory to think. And this, where can we find this fever without temperature? Something like this. Yeah, irritated and cranky during fever. Yeah, Dr. Yash is saying tarantula. And what's the reason for tarantula, dear? Fever, peep, cold. Okay. Your reason is what I like. So, so let us see, because we have to do other things. But what happened after remedy? Let us see that, huh? Within 1 week of the remedy, all the bleeding stopped. No appearance of new ecchymosis. All the old patches, they disappeared. They turned from dark to blue to green and they disappeared. By the end of 1 month, there is, you can look at the patient and say, oh, he is getting better. You can look at his face that he's getting better. His energy levels are back. There is no new hemorrhage, no new bruises. The skin is almost clean. There are very light patches. By the end of third month, the child is playing cricket and living normal life. Parents are worried. Doctor साहब एक खेडन जांदा है, एनु कहो एक खेडिया ना करे. Please, doctor, stop. Tell him to stop playing outside. How will a child stop playing outside? And after about 7, 8 months, patient disappeared. So I had to track the patient down and I told him, bro, get your platelets count done every year and please keep sharing it with me because I want to see that with my own eyes.